Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Wajdan Arishi and I am hematology lab specialist at AMCH Hospital in Asir region. My supervisor is Dr. Muhammad Zawarob at Al Faisal University.
Can you get closer to the microphone?
Okay. Our study is to develop aptamer-based electrochemical biosensor for diagnosis sickle cell anemia. As we know, sickle cell anemia is one of the most common type of sickle cell disease that caused by mutation in the hemoglobin gene, which cause to produce hemoglobin S that change the RBCs to sickle cell. Sickle cell anemia can be diagnosed with different methods, such as sickling test. It's rapid and easy, but it's lack of specificity and sensitivity. The confirmatory test, or the gold standard, is HPLC, or capillaries electrophoresis. It's sensitive, it's fully automated, but expensive and needs centralized lab to be performed in. For that, they started to develop more point-of-care devices for diagnosis of sickle cell anemia, such as sickling, hemotype CS and sickling cis that depend on lateral immunoassay and paper-based hemoglobin solubility test. These two tests have lack of the sensitivity and specificity. After that, we aim to develop electrochemical biosensor, but it's depend on aptamer, which is a replacement of antibody. It's bind with the target with high affinity and specificity. It's the DNA sequence that bind with its target. For that, we use it in our Apta sensor, which could be used as point-of-care device for diagnosis sickle cell anemia. So we started by selection of the aptamer. Selection of the aptamer done by SELEX. SELEX is a shortcut for systemic evaluation of ligand by exponential enrichment. It's a long name. It's cycle by 11 cycle we done, started by incubating our hemoglobin A and S with the DNA sequence. After that, washing to remove the unbound sequence, elution to separate our bounded sequence, and to use it in PCR to amplify our specific sequence. After 11 cycle of this one, we perform the counter selection. Because hemoglobin A and hemoglobin S have high similarity, one amino acid is the difference, we perform counter selection to prevent any cross-reactivity for later. After we finish the selection, we did cloning and sequencing to identify our sequences. After that, we study the affinity of our sequences to award hemoglobin A and hemoglobin S. Then we used hemoglobin A, the aptamer that we choose for hemoglobin A and hemoglobin S, to fabricate our biosensor. The biosensor is electrochemical measurement, so it can be used as glucometer. So the result of the selection process, as we said, we started by SELEX, 11 cycles, we perform 11 cycles. After cycle 8, this is the fluorescence intensity of the recovered DNA after each cycle. This is how we monitor that we are going and doing well during our selection. After 8 cycles, we perform the counter selection, and we notice a gradual decrease in the fluorescence intensity, and that means most of the non-specific sequence have been removed. After that, we study the affinity of these two sequences to award hemoglobin A and hemoglobin S. And we calculate the KD. The aptamers that shows the lowest KD, aptamer 17 for hemoglobin A and aptamer 4 for hemoglobin S. We use it later on in fabrication of our biosensor. Hemoglobin A, we choose aptamer 17. So we take, after the fabrication of biosensor, we measure different concentration of hemoglobin A, started with 1 picomole to 1 microgram. As we measure it, as the concentration increase, the peak decrease, and that means our sensor is good to do it. Then we calculate or concentrate the calibration curve and calculate the LOD. It was 0.8 for hemoglobin A and 1.8 for hemoglobin S. To ensure that our sensor have the ability to differentiate between healthy carrier and the patient, sickle cell anemia, we incubate our biosensor with 1 microgram of hemoglobin AA, hemoglobin AS, and hemoglobin SS. And it shows good response with the presence of hemoglobin, such as in hemoglobin AS, both apta sensor give us a signal. because the high similarity between hemoglobin A and hemoglobin S, and the presence of different hemoglobin in the body, we perform cross-reactivity and specificity testing. And we found that our Abdu sensor give a low response to the non-specific hemoglobin and give us high response to the specific hemoglobin. As a final step, we test our Abdu sensor with real blood sample, and it gave us it was in good agreement with the electrophoresis result, such as hemoglobin AA, it gave us 9,300 in both in electrophoresis and our Abdu sensor. For that, we conclude that our Abdu sensor can be used in diagnosis of sickle cell anemia and differentiate between healthy carrier and the patient. And it was published last month in Biosensor and Bioelectronics. And I would like to thank Dr. Mohammed Zahra for his support and Al Faisal University as well.